All right. Well, thank you so much for joining us today, and I'm so excited to be here in this conversation with Dr. Ilan Shapiro from Altamit. And Dr. Shapiro, thank you for being with us. And I'd love to kick us off with a question I'd love to ask everybody, which is well, for you specifically, in particular, how did you decide to become a physician and sort of how you got into healthcare and take us back through your story?
First of all, thank you for actually this space. It's so important to start conversations, especially right now that we feel that we do not get the information that we want, and the algorithm is the one that's only feeding us, but not necessarily the things that our heart, mind, and soul and family needs. I started young. I was a Boy Scout. I was in Red Cross, and I always knew that I loved the connection between helping, health, improving, making sure that people, if someone got hurt, to make sure that we are taking care of them and moving forward. Then at an early age, I was kind of on that side. When I was probably like 14 or 15, I told my parents, and this actually is in Spanish, now we translate it a little bit. I told them que quería hacer salud pública internacional y que quería hacer las partes de política de salud pública. In English, it sounds like I want to be a physician, international physician, doing public health policy. The issue here is that in Spanish, there's no difference between policy and politics. They thought that that doctor, the first one on the family, would be ending up being a politician. Then there was like it was a huge mess, but they got it. They got it afterwards, a couple of years afterwards. I did, and I really wanted not just to be a doctor, but to make sure that I was creating a better future for the community. And what better way to do that only to become a pediatrician. Then I started at Mount Sinai Hospital. In that phase, a little bit earlier, I used to be the liaison between the WHO and Mexico, and I loved it. Then I got to see the little pueblitos, the little towns in Mexico, all the way to Geneva, and making sure that we are all talking together in a better way.
Wow, amazing. And as somebody whose family is also originally from Mexico, a long journey to come from that background to the role that you have now, and curious to hear how you feel like your personal background and story like drives some of the work that you do today.
Oh, hugely important. My family actually migrated to Mexico. That's why you get a Ilan Shapiro with a jalapeno accent. Then you actually get that I got to see and live firsthand the problems regarding culture, language, and the barriers that we had around us. And of course, I was extremely grateful for Mexico to actually open the doors for my family and give it an opportunity to actually work and be better and contribute to the community. And when I started working in Mexico as a doctor, I started to, and especially at the Mexican Secretary of Health, I started seeing that, from Mexicans, we are 134 million, and probably 20 to 40 million are living here in the US. Then it's not a small number. Then I understood the importance of, both countries, that they were intertwining not just on location, economy, but also with health. And after H1N1, after COVID-19, we knew that health and viruses and everything else do not respect a border. Then my mission completely in life is to make sure that people that have less resources have, like they are running from two or three jobs and they don't have time to have a conversation. Oh, let's check CNN, let's check Fox, let's see where we are in between. There's really no space for that, and that's why it's so important for me to make sure that we're communicating clearly. And I do have a phrase that ended up appearing during COVID-19 is vaccinating the community against fear with a dose of truth. That's one of the most important things that I want to do.
Amazing. And what are some of the ways that you think and approach sort of that translating a very complex, sometimes complex medical information that you're translating that to patients, and sometimes it may be even in the same language in English, because the lingo may be complex and hard to understand. And so, just your approach, what are strategies that you use to help in that sort of a translating of that information to make it real and maybe more relatable to people?
I'm smiling because I love the question. And probably you will go after the phrase that I'm going to tell you, and you're going to like, this doctor is crazy, but I'm going to tell you it anyway. Um, every time that I have an interaction with a patient, with a family, with someone that I'm sharing information, we're talking about health, I portray myself as a waiter. And people were like, why? You're a doctor, you study for 100. It's not, it's the concept of service. When you go to a restaurant, and I will be your waiter, you will come to my restaurant, I will open the doors, I will give you a menu, and I will tell you, these are the dishes that we had, this is the menu that we're serving today. These are the recommended dishes, the specials that we have at today. And you will go with me, and you have, Cecilia, the option and opportunity to say, well, you know what, I'm deadly allergic. I'm more on the vegan side today. And that's okay, but we need to have a conversation. And the promise is that when we see a physician, things have changed. I'm not the judge. I'm not the referee. I'm not the trainer. I'm not the coach. I'm there to provide that service that a waiter, actually, I love that part, to actually have the menu and choose where we are with this. There will be things that I will go like, well, we need to do this for sure because this is my best dish. And having that conversation is the most important part.
Wow, that's such an interesting, I don't know that I've heard somebody else describe it in that way, but some of the research that we've done with parents in particular on how sometimes if they haven't had enough time to think about their options, and I'll kind of use your same analogy. It's like you show up to the restaurant and you're just pressured to choose the dish and you haven't had time to think about it. You react differently to, and that shapes your perception versus, if you got to preview the menu before you showed up. And those are areas that parents have told us, we sometimes just want a little more time. It's not that I'm against vaccines, but I want a little more time to think about it, to read, to show up and make a decision, but just a little more time versus, 15 minutes before the doctor shows up, I'm given a pamphlet and sort of said,
Cecilia,
here's what you do.
you hit the main concept here. After, for decades, for centuries, there was this imbalance where, like, of course, we as doctors, we spend countless hours in the hospital studying books and all that stuff. Uh, but we end up forgetting a couple of things, and we need to regain that path. And you mentioned it perfectly well. When we feel pressure for anything, even buying a car, even like going to a like buying something on a store, when we feel pressure, we don't use the service as much, and we are not that happy. Then I agree with you. Opening that door, giving options, having that conversation is crucial, and also, especially with everything that we're hearing, it's fear. I have so many parents that go like, Doc, you know what? This is something that I'm going to sign off, and this can actually hurt or actually save my kid for the rest of their lives. And that burden as a father, because I'm a father of two, it's cumbersome. Then we need to respect that and actually work with that.
Yep. What are ways that you think the medical community as a whole, and our audience is varied. We work with at Care Message, we work with community health centers and free clinics and tribal health orgs, and the Care Message user can be a community health worker. It can be, just other people that are a part of the broader care team. But I think they play a really critical role in also helping build that trust with parents and with the community. And so, what are maybe strategies you would recommend for them to help strengthen that trust with the healthcare, kind of workforce as a whole, and things that maybe you've seen work well to strengthen that trust with parents as they're coming, in through the doors at a clinic and helping them feel like, they're taken care of.
First of all, the major concern that a lot of physicians, doctors, nurse practitioners, PAs, advanced practitioners have is it's time, because there's all this effort to make sure that we're efficient and we're taking care of our patients, but at the same time, when sometimes there's that perception of, like, we're going to have a hard conversation. This will take longer. I
Mm.
see this as an investment. I do not run away from that part. And let me tell you why. Because if I spend 5, 10 more minutes making sure that they feel comfortable with information, they have enough to decide, and they don't need to decide as we were talking about that at that moment. But at least giving them that part, we're building a relationship. This is not as a 100-meter sprint. This is actually a space where we want to run, for decades together, especially me as a pediatrician. Then giving that space, that investment for 10 minutes can actually help me, take care of that child until they are 21. Then that's the key here, that sometimes because we are on the day to day, we are rushed to answer or give like short answers. And I always tell my students around me, my residents, and everybody around, and even with my amazing nursing staff, we should be like FBI agents, and there's always something hidden somewhere, and we need to actually find that, because that's the way that we can actually resolve the case. Then finding that space, finding that part, it's crucial to make sure that we are doing that part.
Yeah. And I know Ultimate is a very large organization, serves hundreds of thousands of patients, and I was curious sort of what strategies or things that you all have tested that have worked well to sort of, continue to improve like children's health and outcomes, and whether it's vaccines or well child visits, like what are some, if you have, things that you can share about, innovative projects or things that you all have tested out.
Gladly. We know right now that, as a doctor, and you have a lot of things that you can do inside of the clinic, and but sadly that's 20% of the health of our patients. The other 80% is what's happening outside. Those social drivers of health are extremely crucial. Then trying to capture what's happening outside to understand, because it will happen that you have a diabetic patient that you're giving the maximum allowed medications that you can. It's stopped, and the A1C continues, the sugar levels continue to go up, 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 up. And you ask them, are you taking your medication? Yes. And are you doing, and you review the logs and you see that the machine is working, everything is working, but there's no food.
Mhm.
Then, and there's like all this stuff that are happening around them, the stress, sometimes, not a stable house. Then do you have all these things around our patients and communities that we need to take care of? That's one part. The other one is making sure, for example, with ACEs, adult childhood advanced childhood events, ACEs, that we are actually tracking them. A lot of people go like, "Well, you're tracking them. You need to do something." Yes, we want to do something about it, because especially for kids, if there were violence at home, lack of resources, insecurities, of course that kid is not going to do well at home, not going to do well at school, not going to do the things that they need to do. Then combining all these things, it's crucial that we understand that yes, we need the best healthcare for our patients, but at the same time, we need to go outside of the four walls of the clinic to actually accomplish the other 80%.
Yeah, I think it's that those pieces are so critical, and we're gonna have a panel later with an organization called RX Kids that's testing out a model of just giving cash payments to mothers and for children, and just having that flexibility, I think, for parents to apply those funds to what they need, whether that's diapers or food, or it's hard being a parent. It's much harder to be a parent, in a low-income family, and then you have multiple jobs and multiple kids, and it's a lot to manage. And then, to have, and I think every parent wants the best outcome for their child, and sometimes they just don't have either the resources or they need some support on building skills because they might not have seen when I did a training to be a court-appointed special advocate for children in foster care. And I learned so much about how much, for a lot of the parents, it's generational trauma. And so they're doing what they learned. And they might not have just learned the right skills as a parent to parent their own children. And they just need a little, maybe a little coaching, a little education to sort of change that outcome for their child. And I just believe all parents want good outcomes for their kids, and they may just be lacking the either the financial resources or the skill-based resources to do that.
Completely. And that's the part of going directly to the community. And it
Mhm.
helps a lot when you have like same language, same culture, but that doesn't limit other, like if you don't understand the language or the culture, that doesn't limit the opportunities that we have. But it's important to be sensitive on, like maybe, they actually use herbs more than I used to, or like there's like certain treatments in Mexico we do like sobada, like
Hmm.
when we have like a horrible fracture, it was like special doctors, well, we're not doctors, like people that will be kind of the ones that will heal the wound,
The curanderos,
actually rob the fracture, then of course, you have more complications of that. Then knowing at least that the community that you're serving, and knowing all these little healthcare nuggets can make a huge difference.
definitely. One of the things that I've seen you do really well is use social media to kind of share information, and I'm just curious. It seems looking back to what you've shared, like a natural sort of transition as a way to spread some positive healthcare information out in the world. But curious how that work got started and sort of what you've seen be successful in that approach as well.
One of the things that I use this, and I'm going to be bluntly honest, it's my therapy. When I see something weird that I think people are, it could be weird information with weird terms or a weird moment, that's when I actually create that stuff. And the entire idea is to generate a conversation. And whenever I create anything, I'm looking at a family that has two or three jobs. They are doing their best to protect their children, grandma, grandpa, multi-generational households, and especially in Spanish.
Mhm.
There's tons of amazing creators all over, but I want to actually be part of the experts. There's like influencers, but I really want to be part of that conversation as an expert and share, the pitfalls of the things that we have. And one of the things that I try hard to do is translate medicalish, that language that we do not understand from doctors and nurses and nurse practitioners and advanced practitioners and even dentists and behavioral health therapists, to a language that can be actionable. What do I do with this? Then packaging that in a 1 minute, 2 minute video. And by the way, I do it completely as therapy, as fun, as something that, if my mom, my grandma, if she was alive, or any of my family members will be watching it, they will get some type of value. Then I don't go for the algorithm. I actually, the thing that has helped me a lot is actually just go with information that I truly believe that it's, what it's needed.
Yeah. Yeah, the authenticity I think definitely comes through in how relatable I think that information is for people. And have you had anyone, I guess, kind of what does that engagement maybe look like with people that come across your content, and ways that you feel like it's maybe contributed to changing the narrative that people, that's out there in the world in a different direction.
95% of the time, it's positive, it's grateful, it's really honest questions. I talk a lot about autism, vaccines,
Mhm.
current events across the country right now. Like it could be a heat wave, it could be actually a storm, like it could be an outbreak of, salmonella. Then there's like multiple things that are happening around our life that are important, and it's great because in my office I can see maybe in a imagine that and these numbers are not real, but imagine that I see 200 patients a day 200, impossible, mathematically impossible, but 200 patients a day with one post, or when I do a lot of interviews in TV or radio, I'm reaching millions in 3 minutes. Then the engagement part, the conversation part, the being there, and honestly, the honor of for me, for them to actually open the door. That way, I'm inside of their screens and their families and their minds. It's truly an honor.
It's incredible. And I wanted to go back to the conversation we were having, maybe around vaccine hesitancy and how, in a lot of ways that hesitancy a parent may have may just be like a barrier in disguise. And what are ways that you've been able to, or maybe what are some of the examples of times that you've helped a parent kind of get to the root cause and maybe examples of where you've been able to kind of be successful in changing maybe their perception around, a specific sort of topic that led to their hesitancy.
Cecilia, you're going to laugh. The first thing that I do is I clear my mind. Um, we already carry a lot of bias for many things. Maybe you love, vanilla ice cream or strawberry ice cream, and that's perfectly fine. But if you see the chocolate one, you have no idea what to do with it. Then I clear my mind to make sure that when I'm entering the room, no matter what happened on the last interaction or 2 months ago or whatever, I am in as a provider, as someone that will give them the best advice that I have. The second part is that truly I put the first second filter is that I treat them as they were my family. Because at that moment, sometimes when you're a officer of the law, you're a physician, you're a soldier, you need to create barriers between you and everything else, because we see tough stuff. We see like the best things of life and the worst things of life. Then I try to actually, when I think about them as my family, that barrier goes away. It makes me more sensitive of what's happening on the room, what's happening with the kid, what's happening with the family, and that actually helps. That perception helps. And when I start the conversation, and we're going to have a tough conversation, let's talk about vaccines because they don't want them. There's a couple of models. The one that I use is making sure that it has like 3 stages. The first one is, what's happening, why I'm recommending this, and why I am actually connecting with them, why I had the same questions. And one of the conversations that I had regarding vaccines, I told them, like, I'm a father of two. I honestly, like any procedure that my kids need that can hurt them or benefit them, it crosses my heart, and I actually advise and check the numbers. What happens with vaccines that I chose to vaccinate my kids as the American Academy of Pediatrics was recommending, as the protocols that we have done for decades. Um, and I cried every single time the first year of life for every visit that they came in, to the point that my nurse was like, Dr. Shapiro, what's happening? Like, no, 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 no. And that is Shapiro right now. No, 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 no. Take away everything else. Then with the same sensitivity, I tell them, I get it. I'm a father, I'm a parent, like I understand where you're coming from. I give them the facts of that vaccine, what's the advantages, disadvantages, talk about the disease, what happens if they don't get it, what's happening around the community. And at the end of the day, the third phase is, with all the information that I told you, what do you want to do next? My recommendation, clearly I stated, is X, Y, and Z. What do you want to do? And when they tell me yes, no, maybe, I always leave the door open. Always. Because you mentioned it, Cecilia, at the beginning, maybe they actually need some more time. Maybe they need to talk
Mhm.
mom and dad. Maybe, but I give them resources, I give them websites, I give them, for example, with the American Academy of Pediatrics, that's a huge list of things that, influencers, for one side, but doctors that are experts on the field giving great information. And I do ask them, come back with us. Come back with Ultimate. Make sure that if you have a question, you have a concern, we're here for you. Then that way we close the circle, because what's the worst thing that can happen? Imagine that you have a partner and you had a horrible fight and you go like, I'm done with this partner, and you get another one that it's actually even worse. Then my deal is we fight or we have an issue or whatever, we let's build a relationship. Let's make it stronger. I don't want a one night stand. I actually want a really good relationship. Take me to the movies, have a dinner with me, do other stuff. Then that's a relationship that I want to build with my patients.
Mm. Actually, I'm laughing over here because my son has his well child appointment downstairs today. I came upstairs to do the call because he has his 4-year visit and he's getting some of his vaccines today. Yep, and I had over the last couple of days I was talking to him about it and just preparing him, and this is the doctor's going to come and they're going to do the visit and you're going to get vaccines and this is why you're getting vaccines, and I'm just it triggered for me a thought of like how you involve the child and the patient, right? Because a lot of times when they're little, well, it's a lot on the conversation with the parent. But as we start to get to the teenage years, there may be an element of a conversation with the child as well, and like the why behind vaccines or decisions that they may start to own as they start to take ownership of their health. And just sort of curious if you have had anything that you do slightly different when you're having that conversation with the child as well.
I always tell them the truth. Um, I first of all, I tell them like it's going to hurt. It is, because the worst thing that we can do as parents and actually as healthcare providers, physician nurses, is tell them, hey, it's not going to hurt. It's going to hurt. It's not the most horrible pain that you're going to have. It's kind of a pinch and it goes away. But it's not the fun part of it. The other thing is that I try to relax the parents. Kids are extremely sensitive on the energy and the physical expression of anxiety of parents. And us as parents, we do a horrible job doing that. Then we need to actually bite our tongue and try to make sure that we are there for our kids. And not only there for our kids, but making sure that we are relaxed as much as humanly possible for the procedure. Because if not, the kid will start like hugging us, we will hug the kid. And the second one is making the child as comfortable as possible. If sometimes we can actually give the vaccine in different positions, places, and stuff like that, then adjust where we are with that part. I love the little, like the mind is amazing. If you can actually distract them at the moment of the shot, most of the kids actually do not even feel the vaccine. Then that's one of the things that we need to do, tell the truth. And of course, I always explain that at the moment that we're giving this, it's making sure that we're sending the pictures to our amazing security officers inside of our body. Those pictures are the ones that are from the bad guys. That way, if they actually come inside of us, they know what to do and get them easily. And that way, we don't need to be sick. We want to actually be playing football. We want to actually do our math exam, but not necessarily spend 1 week or 2 weeks or with complications of something that we can prevent.
Yeah. Yeah, I ordered one of those. I don't know. We'll see if it works, but one of those that has like the little dots to try to kind of
Positive.
numb.
Yeah,
Yeah. I'll have to let you know later if it ended up working out. I haven't heard any yelling yet, so I'm hoping
that's
it
good.
it
That's
worked.
good.
Well, we're wrapping up around time, and yeah, last question here. For everyone that's watching, if there's one thing that you would want them to take, to their own clinic, next Monday morning, and that would help shift maybe their approach to these vaccine conversations, what would you want that to be?
Be bluntly honest. Right now, our families are already struggling with tons of information before you go to the clinic, before they actually see you at the clinic. Then understand that they already saw the social media post, the algorithm gave them all this crazy stuff. They're coming with fear, doubts, and everything else. Then understand that when they come to you with questions, it's not an attack directly to us or to them or a fight about power. It's truly most of the time coming from the heart. Then we should have and spend enough time to actually answer those questions. And if we sometimes they ask really tough questions, like, do you know the chemicals X, Y, and Z? And maybe we just don't. Then it's okay to tell them, like, let me search around, let me grab some of my fellow doctors and get that information. And the third one is make sure that you're pointing them out to trusted sources of information. In Altamed, we have a website. There's the American Academy of Pediatrics website. There's a healthychildren.org website. There's Vaccinate Your Family. There's a lot of really good resources out there in different languages that family can actually get in contact with. We have a fight right now about fear. I stopped calling it disinformation and misinformation. It's just fear. It's a fight against fear, and we need to continue vaccinating our communities with a dose of truth.
Thank you so much for your time today and for sharing all of your insights. We are extremely grateful and we're so grateful to have had you with us today. And any last words?
I'm always there for you if you're lost in the California area. We have a couple of clinics between Los Angeles and Orange County. We are always ready to collaborate because altogether we're actually doing this good job of sharing resources, sharing information, creating a space for our community, no matter where you're coming from. And also, if we don't do it right now, we already have cases of whooping cough. We're seeing all these diseases that are coming more often than none. Then, if we are not advocating, we're not sharing information, and we're not opening our hearts to our patients, we know the results. The problem will be in like a couple of years where, like all these things that we were already controlling, they're going to come back.
Yep, definitely. All right. Well, thank you again. And to the group, we'll move on to the next session and we'll chat soon.